everyone. It's Pam here from Your Nurse Advocate Consulting. So June is both Alzheimer's as well as Brain Injury Awareness Month. And so today's Tuesday Tips is dedicated to caregivers that are supporting loved ones with Alzheimer's disease. Whether you're new to caregiving or you've been on the journey for a while, I want to share a few essential insights and some actionable strategies that will help you feel empowered and feel like you have a little bit more control. We're going to talk a little bit about brain injury later on, and the reason why they're kind of grouped together is because people that have traumatic brain injuries can have changes to their personality. They may be a completely different person. Someone that was quiet and soft-spoken can become very outgoing, no filters, say what's ever on their mind. So a lot of the ways that we care for them sometimes are interchangeable, but that's one of the reasons why I think that they group the traumatic brain injury together with Alzheimer's, because it affects all parts. It affects our behaviors, our memory, and our personalities. So let's go ahead and jump in. So Alzheimer's disease is the most common form of dementia. There are several forms of dementia. There's Lewy bodies dementia, there's vascular dementia, there's many different types of dementia. And the Alzheimer's, it does affect the memory, it affects thinking, and it affects your behavior as well. Alzheimer's, one of the difference between Alzheimer's and some of the other dementias, it's not the only one, but it is one of the few that is progressive, meaning symptoms gradually worsen over time and people can pass away from Alzheimer's. Alzheimer's is one of the dementia diagnoses that is recognized by Medicare and hospice as once they reach a certain stage in Alzheimer's that they are eligible for hospice care, because they literally forget how to eat, they don't talk, they can't walk. And so it is a very cruel and impactful disease. And a lot of people, I've seen it's from beginning to end in 9 months. I've seen beginning to end to go on for years. So everybody is a little different on the journey that they take with their Alzheimer's disease. So early signs of Alzheimer's might look like simple forgetfulness or confusion. I'll never forget early on, one of our Alzheimer's clients, she actually called me up and asked me to come over and speak with her and her husband. She had something she wanted to talk to me about. And she actually was talking about her concerns that she hasn't been going to church. And that was a big part of her life. She would have Bible studies at her home, and her faith was a big part of also her social life. And so she said, you might want to know why I haven't been going to church lately. And she said, because I've realized that I'm, become more forgetful, and I am afraid that I'm not going to remember the names of the friends that I've known in church for so many years. And that's embarrassing for me. Can you help me? And so this was very early on in her diagnosis with Alzheimer's. She was scheduled we got her with a gerontologist. She was on some medication to help try and slow it down. She did everything she could possibly do. And her husband's one wish is that she stay home with me. I don't want her to go to a nursing home. Can you please help her stay home and stay safe with me? And so that's a long story, but we won't get into all of that today. But I just want to know that in the beginning stages, people can realize that they are becoming forgetful. They can realize that they're not remembering things, and it's very disheartening for them, and it's kind of scary. So another early symptoms would be struggling with familiar tasks, just forgetting where something belongs, forgetting which drawer the silverware goes in, misplacing items. Later on, they can actually hide items, not because they're being malicious and wanting to hide items. They become paranoid and very, very fearful. So they're hiding important things. Like this particular client, her husband could never find his glasses, and she was always trying to put them in a safe place, but we'd find them in the microwave. We found them in her underwear drawer. We found them in the freezer one time. So it's really inappropriate places, but it's coming from a place, a good place, but it's just not a practical or appropriate place. And so you can start noticing these things. I mean, we've all had episodes where we say we can't find our keys, and there's a big difference between normal forgetfulness with aging and when you have a form of dementia. So there's are some big differences there. And so remember, Alzheimer's is a disease. It is not a normal part of aging. While there is no cure yet, there are ways to manage some symptoms and trying to improve the quality of life for both your loved one and yourself and those caring for the loved one with Alzheimer's. So let's talk a little bit about the caregiver's role. So the caregivers are truly the backbone of Alzheimer's care. I mean, you're not only helping with the daily tasks, you're preserving your loved one's dignity, providing comfort, and advocating for their needs. And caregiving can be very demanding both, emotionally as well as physically. It's, so it's okay to ask for help. And it's really essential to care for yourself. I remember this client, and I use this client example often with Alzheimer's because she had her brother also committed suicide during his later stages with suicide. It runs in her family. And she had probably every complication and everything you could think of that an Alzheimer's dementia person could have. She was climbing out of windows. She thought her husband was a murderer. She was eating and drinking things that she should not, that we were safe. We had to lock things up. I mean, everything that hitting and behaviors and anything that you can imagine, your worst nightmare of symptoms, this woman had. And to think about the loving and caring person that she was, before the Alzheimer's took a great toll on her family. And so just know that it's okay to help. I mean, you have to take care of yourself. You can't give from an empty cup. So we look at the stages of dementia. They gradually can throw them, dementia as a whole can throw them in buckets of like 3 stages: mild memory loss, confusion, changes in mood or personality. Your loved one may still be independent, but might need some reminders. Now, when we're looking at Alzheimer's, and we're looking at whether or not you're meeting criteria for hospice services, there actually is 7 stages. And when you get to 7, there's an A and B. And so it's not until you get to that 7th stage where they're really unable to walk, really care for themselves, aren't able to speak, or maybe not eating, is when hospice actually can become appropriate. So it's difficult because we can use the extra help before we get to those last stages, but that's if you're looking for meeting hospice criteria, you have to get to that 7th stage of Alzheimer's. But again, we're just talking general dementia, so that would be an early stage. Again, memory loss, confusion, changes in mood or personality. Your loved one may be independent but still needs some help or reminders. Then you've got the middle stage where you've got increased memory loss, difficulty recognizing people, wandering, changing in sleep. This husband of this client we had, he actually went to bed with the flashlight turned on and put it under his covers so that when she would jump out of bed or get out of bed, he was ready to go to see what she was getting into. And people may think that that's kind of an extreme measure, but he was willing to do all those things to try and keep her safe because he, more than anything else, wanted her not to have to leave the home. He wanted her to stay home with him. And we were able to achieve that. She ended up with 27-hour care around the clock. We had agency private caregivers. It was quite the task, but we were able to help him meet his goal. So the middle stage is most often when caregivers start needing some support, especially if you're in that sandwich generation or you're still working. So you've got a career and also trying to manage the care of an aging loved one. It's okay. It's okay to need help. It's absolutely okay. It's not a sign of weakness. It's a sign of strength to recognize your limitations and knowing that you need help. And then there's the late stage where we've got loss of communication abilities, significant physical decline, weight loss, and really we get to the point where they need some full-time care needs. They become incontinent. Another Alzheimer's patient, I'll give you another example. We got her on hospice when she had gotten out of the hospital with a serious septic infection, a urosepsis from a urinary tract infection. And what led up to that is in her later stages of her Alzheimer's, she never told the family. When the family would ask her if she had to go to the bathroom, she'd always say no. She went, I think it was approximately 36 hours without urinating. So you've got all that urine sitting in the bladder, cooking up that bacteria, and she became very sick. So when we got her at home, we put her on a toilet schedule, and she would cuss me up a storm and tell me that she didn't have to go to the bathroom. And I would say, just humor me. Let's go in there, and get you on the pot. And if you can't go, that's okay. And every single time we would take her to the bathroom, she would kick and scream going, but every single time she urinated and went to the bathroom. So that's the kind of things that you'll run up against. So it's really can be a big challenge to keep them healthy and to keep them safe. So understanding these stages kind of helps you anticipate changes and to be able to plan ahead, looking forward what the needs might be. So let's talk a little bit about some disease-specific strategies. One is, creating a consistent routine. This first Alzheimer's client I was talking about, she liked the routine that she was normally in. She would not eat unless people were sitting at the table eating with her. If she was sitting there with the caregiver was put her food out, caregiver went in the other room to take their own break, she would not eat. And so we had to insist that the caregivers would eat their lunch, at the table with her, or she would not eat. Doing dishes. It was important for her to do dishes. So we had to replace the dinnerware, the plates and the cups and everything. We got rid of all the glass and we used all plasticware so that she could safely wash the dishes and not have to worry about anything getting broken. Even folding towels or folding washcloths is often a very comforting task for people with Alzheimer's because it's a very mundane routine thing that they're normally doing. So it's a safe thing for them to do. It's kind of that muscle memory that they know how to do that. And oftentimes, even bedtime, keep that consistent, the same routine. People, with dementia, they thrive on that routine. So this really helps to reduce the anxiety and it helps them feel more secure. And that's, a lot of people get misunderstood about behavior. And oftentimes it's not the fact that they're trying to be mean. It's the fact that they're acting out of fear and they feel that they need to protect themselves. They get very fearful and very paranoid, with dementia. So just try and understand the first thing to do to try and de-escalate them or bring them down as they're ramping up, maybe with aggressive behavior or getting loud and getting angry, is to reassure them that you're here, they're safe, you won't let anything happen to them, and then try and distract them onto a different activity. And sometimes that is extremely helpful. Another thing is communicate very clearly. Don't give them a short list of things that you want answers to or things to do. So use short, simple sentences, speak slowly, maintain eye contact, and use a gentle touch, just to reassure them. Try and be patient, give your loved one some extra time to process and respond. One of the things is they very much like to be in control, but if they insist on dressing themselves or choosing their clothes, maybe take out 2 outfits and say, Mom, here's what I found in the drawer. These are a couple options for today for you to get dressed. Which one would you like to wear today? Because if you get hung up in 2, 3, 4, and 5s of things, it's going to be extremely overwhelmed. They'll get frustrated. They could get upset. And again, lead to some aggressive behavior because now we've just overwhelmed them. We want to prioritize safety, tripping hazards, remove throw rugs, lock up medications, consider using door alarms if wandering is a concern. And yes, we had to do these. We had to put alarms on the windows. She would actually open the window, try and climb out. Same thing at night, with the doors. And so if wandering is a concern, you may have to do that. Also, keep emergency contacts and important medical information handy. We've got an emergency to go folder checklist, which is a great tool for you to have. We can put the link in there for that. That's free, and it gives you the contents of what you should have in a folder, so that if anything happens, they're ready to go. All you do is who's ever with them has to grab that folder, and wherever they go, they will have the facility, the hospital will have, or the emergency room will have everything they need to understand what their care is all about. Again, when we talked about doing the dishes, again, one of the things is to encourage their independence. Let your loved one do as much as possible, even if it takes longer. And if you're one of these type A personalities where, oh, just want to do it because it's quicker and I'll get it done and over with, this is going to be very hard for you. So just try and kind of bite your tongue and, but allow them the extra time to do that, because again, it might be quicker and faster for you to do, but that's only going to, again, set up a situation for some behavior changes. So when we're talking about managing challenging behaviors, agitation, aggression, sundowning is when late in the day, they call it sundowning because early evening as the sun goes down, especially if they're in an unfamiliar setting or out of their normal home, they can get confused more so than during the day. They can have some behavioral challenges, and it's kind of a flare up, so to speak, of what they're already experiencing, but it can get worse in the evening. So this can be very common. It's very common even for people without dementia, an aging adult, to go in the hospital. They're pulled out of their familiar surroundings, and at 1, 2 in the morning when they wake up and they see all these lights on and they're out of their environment, they can get very confused as well. So this sundowning happens not only to people with dementia, but to other elderly people as well. So when we're look for triggers. Normally when they're acting out, they're afraid, they're tired, there could be hungry, or they're in pain. So usually there is a reason. So I'll give you an example. We took an Alzheimer's patient. She loved ice cream. And so we kind of went on a field trip with their granddaughter and her husband, and we went to her favorite ice cream place. Well, going through the line, she got the sundae that she wanted, but she neglected to say that she wanted nuts on it. So we got through the line. It was a very busy ice cream shop. We sat down and she says, "Where's my nuts? I want my nuts on my sundae." And the granddaughter says, "Oh, Grandma, that's okay. The line is really long. The next time we come, we'll get you your nuts." "No, I want my nuts now." And I was there, so I immediately saw her behavior and her mood change and escalating. And I knew if we didn't get her nuts for her sundae, we were going to have a scene in the ice cream shop. So I went up. I apologized for skipping in line. I says, "I apologize. We have someone with dementia that we forgot to get their nuts and they're getting a little upset. Can I just get a little cup of nuts?" And they were very understanding. They gave me a little cup of nuts. I came back. We put the nuts on her sundae. Her mood changed immediately. Everything was hunky-dory and she enjoyed her sundae. So don't neglect the little things, because the little things can turn into a huge scene and a huge deal. So we might think it's something that we should be able to just put off for now or blow off, so to speak, but to them those little things can be really big. Redirect their attention to their favorite activity or music. So this one of these Alzheimer's patients, the first one I talked about, when she would escalate or become fearful, overly paranoid, angry, aggressive, with her faith being so important to her, we relied on her Bible a lot. Her favorite book of the Bible was Psalms, so she would like to read. We would read her a story, out of Psalms, and that would immediately calm her down. And we would often do that if she was struggling to go to bed and was just kind of worked up. We would do that to get her ready for bed. And so that might not work for everybody. It depends on their personality, their choices, and what are comfort things for them in their life and in the past. But try and figure out what is one of those things that will comfort or kind of bring down your aging loved one, something that they've done all their life to help bring them peace and tranquility. So one of the other things is try avoiding arguing. And what a lot of people make the mistake in doing is correcting their aging loved ones when they're wrong. "Oh, today's Tuesday and it's going to rain." Well, you want to say, "No, it's Monday and look outside, the sun's shining." Disagreeing with them, that's the quick path to ramping up, escalating any mood changes, aggression. you got to remember that they live in their own reality. And for us, it doesn't make sense to not correct them, because we're trying to, to correct them, but they are in their own reality. And sometimes for a peaceful life, we need to live in their reality at that moment. And so it's okay. I mean, if that brings them peace and that brings them joy, whatever they're saying and whatever they believe at that moment, it's okay. You don't have to, correcting them. A story, I actually saw this on TikTok, and it was a story where a daughter, an adult daughter, found her mom walking down the road, and she had gotten out of the house. And she caught up to her and she says, "Mom, where are you going?" And she says, "Well, they were on the East Coast." And she says, "Well, I'm walking to California." And rather than saying, "Mom, California's on the other side of the country, it would take you forever to walk there, let's go home," she didn't. She says, "Oh, well, Mom, would it be all right if I walked with you? Would you like some company?" And her mom says, "Oh, yeah, that'd be great." And she would say, "Well, Mom, California's a long way. Do you have any plans for, taking breaks, or we can camp along the way?" She said. And she says, "Well, Mom, California is very warm, but we're going to have to go through some areas that are pretty cold, and you don't have a coat on. Maybe we should go home and pack some things that we might need, to take on our walk and our journey." And she says, "Oh, that's a really good idea. We should do that." So she turned around and they walked home. And once they got home, she was distracted and on to another thing. And they never had the conversation about walking to California anymore. So, sometimes going along with it and just coming up with creative ways to distract them or change the subject is enough. And it didn't raise any behaviors, no challenges. She was very agreeable to going home and packing properly for the journey. So those are just some insights that we've seen, really work. Let's talk a little bit about self-care for caregivers. As I mentioned before, you can't pour from an empty cup. So you need to take breaks. You need to accept help. You're not proving to anybody that you could do this on your own. All that is it's frustrating for those that want to help you because they know you need help. And it's also frustrating for you because you know you need help, but you're too proud to say that you need help. So it's okay. I promise you, it is okay to be able to accept help. There's online support groups. We're going to list a bunch of resources for you. Oftentimes, local areas have Alzheimer's support groups for the family caregivers. Your county resource on aging in Wisconsin, here we call them ADRCs, or Aging and Disability Resource Center. Every county and every state has them. It's just your county government agency on aging, and they have all the local resources for you. Food pantries, Meals on Wheels, Alzheimer's support group, dementia. I mean, they have caregiving companies. They have all the local resources, lending closets for equipment. Those are your first. We always encourage our clients and people that we work with to use them as the first resource. Watch for signs of burnout. If you're becoming more irritable, you're less patient, you're less tolerant about things, you're snapping at your own family members, you have a sense of feeling overwhelmed. I can't get up and do this for another day. If you need respite, it's okay. There are nursing homes, hospitals, assisted livings, memory care units. They do respite, which means some of them are usually like a week minimum. Some might be less, but that's what we found on average. They will take your loved one. It is private pay. They do have a daily rate, but they will take care of your loved one so you can take a break. Go to that family wedding. Go to that family reunion. Take a vacation. It's okay. You need to take care of yourself. Professional support. When do you need professional support? Well, that every family is different, and we get involved with people. Sometimes they get to the point where they do need help and they don't know how to put a plan in place, or they want some help to put a caregiver team together. Perfect way for us to help. Sit down with the family on how to manage their dementia, put a plan in place. What should we do? How do we find door locks? How do we find door alarms? Window, help them with those logistics. Those are some of the ways that we can help. Again, finding caregivers, we help with that. We also link people with community resources. The Alzheimer's organization, the Alzheimer's Association, they actually have a 1-800 24-hour hotline that we will share in our resources for you. And that is really important to be able to have access to at any time of the day or night. We help with care transitions when someone's going from the hospital to home or from the hospital to a nursing home. We can help with those transitions, make sure there's no medication mistakes, the treatment plan is followed, everything's correct, and there weren't last minute changes that no one was aware about. We kind of keep all those balls in the air. We can attend virtually doctor's appointments to make sure that the family understands what's going on. We help those long distance adult children of those aging adults when so that they don't feel as guilty not being there all the time, because they know they have us, have eyes and ears on managing the care of their aging loved ones. So these are just resources. Keep an eye on what daily needs are coming up. Even if you live far away, don't hesitate to ask for help. No one should have to do this alone. So let's just take really a brief, and then I'm going to wrap up, and I will include the resources in the replay and the notes of our video. And so brain awareness connection. So since June is also Brain Awareness Month, I just want to mention that brain injuries like falls, strokes, trauma, motor vehicle accidents, motorcycle accidents, they can sometimes mimic or even worsen dementia symptoms. Sometimes going under anesthesia for a surgery for a dementia patient, they come out of surgery and their dementia is worse. A lot of things can happen when you have a brain injury or things aren't working quite right in your brain. And so if your loved one has a history of brain injury, be sure to mention to their doctor. Early recognition and intervention can really make a difference, especially if you have a brain injured person who's starting to get worse or showing signs of dementia. So we list the resources for you, and that is going to actually wrap it up for this week's Tuesday Tips. I just want to thank you for joining me. Thank you for catching the replay on our YouTube channel. Feel free to subscribe so you get all access to all our most recent videos and interviews with other caregivers, other companies, and other services that support our aging community. And, share this video with anyone that it might benefit. So drop your questions or experiences in the comments. We'd love to hear from you and answer any questions that you might have. Or you can always reach out to us directly. We've got our website there. So take care of yourself. Remember, you're not alone on this journey, and we'll see you next week. Take care.